Well, this week is World Quality Week with the theme Quality Conscience, Doing the Right Thing. World Quality Week champions excellence in product, service and organizational performance. This year's theme resonates with the South African National Blood Service, that's the SANBS, as a quality-driven health service provider. The blood bank ensures world-class control measures for the ongoing safe blood supply of the country. We're now joined via Zoom by Thandi Mosupye, who's the communication manager for South African National Blood Service. Very good afternoon to you, ma'am, and thanks so very much for joining us here on SABC News.
Good afternoon to you, ma'am. Thank you, and thank you for having me.
Welcome. Let's talk about World Quality Week and what it entails and exactly your involvement as a blood bank in this particular initiative.
Okay, so Quality Week for us is very important as an organization. As you know, that we operate within the healthcare sector, and it is one of the sectors that is really challenged in terms of resource constraints. So we find that, by abiding to strict quality protocols, we are able to mitigate risks, but we are also able to benchmark ourselves against international standards. Yeah. And we also make sure that we leave no compromise in terms of, what we do around quality management. So from a quality point of view, we make sure that quality permeates through our entire value chain, which is from our collection, which also entails and goes into our processing, the way that the blood is processed, how we distribute the blood, and by the time that it gets to the patient, that it follows a strict quality protocol.
Yeah. I would imagine that a lot of people have a lot of faith in SANBS when it comes to the issue of quality service. But interestingly, you mentioned the fact that you do operate within the healthcare sector. And we've certainly seen a lot of challenges when we're talking about the healthcare sector, particularly public healthcare sector. How does that affect you as SANBS in terms of being able to put out that quality that you pride yourselves in? And I can certainly hear you as you speak. Is there an effect on you as SANBS?
Of course, with the constraints that I've already indicated around the healthcare sector, it's, there's challenges in terms of making sure that the quality of service that we take out is good, meets the international standards. But also our healthcare sector, as you know, that it's got a lot of challenges from a point of view that there's a whole lot more people and less resources. But what we do from a SANBS point of view is to ensure that we don't compromise on quality. Whether you're in the public health sector or you are in the private health sector, we give the same standard of quality in terms of our blood products and blood services.
Yeah. Of course, SANBS has and continues to caution against the low levels of blood donation in the country. How is that situation now? And I can't imagine that things might have, changed, when we were really deep within the pandemic and perhaps people just not, coming in to donate blood. But then, of course, one can argue less people were on the roads and maybe less people were needing blood. Maybe you can talk to us around that situation and where we are now.
Okay, so in terms of where we are right now, we find that our blood collections are compromised. And this is largely due to the good weather in terms of the rains that have been happening. So, when it's raining, people don't want to get out of their house. They want to stay indoors and they don't want to, face the weather out there. So we find that there's really challenges from a collections point of view around that. Mm-hmm. But what we are actually assuring South Africans is that from a donor clinic point of view, we do have the facilities where they can be able to come in and still donate. Mm. And what I also just want to say is that we do need the blood. Our blood stock levels, as you say, are very low. And in most instances, people associate blood with accidents. And it's not necessarily where the majority of the blood that we collect goes in. Mm-hmm. Majority of the blood that we collect goes into people that have got lifelong diseases like your cancers, organ donor patients, and so forth. So that's where we really, really need blood. And these are people that cannot live without the donations that we ask for on a day-to-day basis. Just the other day, our stock levels were so low, and I'm happy to say that yesterday there's been a remarkable improvement based on the calls that we've done, where people have really gone out, raised the reins, and gone out and donate. And we urge South Africans to continue during this coming week to really go out and help us with the collections around blood.
All right, Thandi, thank you so very much for giving us your time. All the best, and thanks very much. Thandi Mosupye, who's the communications manager at the South African National Blood Service, that's SANBS.